7-year-old boy in Georgia has died due to COVID-19, and he is believed to be one of the youngest victims here in the U.S. He had no other underlying health conditions. Last month, a 9-year-old girl in Florida also died from the virus, and she too had no previous health conditions. Virginia also reported a child under the age of 9 has died there due to the virus, but did not release any additional details. And as this pandemic wears on, doctors want to make sure that parents are still bringing their kids in for routine vaccines.
Joining us now with more on that and the impact of the pandemic on kids, Dr. Julie Holland. She's the Vice President of Pediatric Primary Care. Hi, Doctor. Thanks for joining us.
Happy to be here. Thank you for having me.
The back-to-school time is typically a time when parents are reminded to get vaccinations. They have to fill out paperwork for schools. How is remote learning and COVID and all of that impacting vaccinations for kids?
So hopefully it's not at all, but we know that it is. We know that COVID caused a big drop in vaccinations for younger and older kids in the spring, and the CDC really alerted us to that drop. Since then, we've really worked hard to get kids back in our offices and make them as safe as possible. But parents are doing the right thing in trying to keep their kids home as much as possible. We just want to get out the message that vaccines are an important part of keeping your kid healthy. And so keeping them at home and keeping them socially distanced is important, but so is vaccinating them against life-threatening diseases. And the flu season's coming up, so that's on our list of vaccines now as well.
Yeah, we'll talk about that in just a second, but you're right. It is so difficult for parents right now trying to figure out exactly what to do. We've seen that the governor eased some of the restrictions, some of these stay-at-home orders. As you talk to pediatricians, are they telling you that parents are now feeling confident enough to go back to the doctor's office and get those vaccines?
Yes, we've seen a big jump in kids coming back into the offices this summer. Our offices were pretty quiet in March and April and May, but kids are coming back. We're seeing a lot of older kids coming in for physicals, school physicals. We're not doing very many camp physicals, obviously, this summer. But yeah, we're starting to get kids back, and we're vaccinating them at every opportunity we have.
What are some of your concerns as kids transition to remote learning, if that's what their district is doing?
Well, you know, school in person is incredibly good for children on so many levels, but given the current pandemic, there are obviously limits on what we can do now. And it's most appropriate for school districts to make the best decision for their kids. But, you know, we have to remember that a lot of kids rely on schools for lunches, for some school health care, for emotional support. There are a lot of things that kids get from school that they can't get at home. But again, we're in a pandemic, and so the most appropriate place right now might be home. And hopefully as things, hopefully as the pandemic goes away, when we have a vaccine, we'll start to get kids safely back to school.
The other side of this is flu season would be coming up, and a lot of these kids would get a flu shot as well. Is that what you're recommending at this point, or how does that work along with, you know, a potential COVID vaccine that we may be getting?
So the time is now to get flu vaccine. You're right, Lourdes, and we want kids in our offices getting flu vaccine. Most vaccines start coming into our offices at the end of August and the beginning of September, so September and October are really the peak time. And not only are pediatricians' offices a great place to get them, but you can get them in several retail stores or at county health departments, and large hospital organizations are running flu clinics as well. So yes, come in and get your kid vaccinated. You have to remember that flu symptoms can be quite similar to COVID symptoms. They both diseases start generally with an abrupt onset of a fever and chills and cough, and people can get quite sick with either. And so first of all, we don't want people to get sick. We want people to be well. But if we have a flu epidemic and a COVID pandemic going on at the same time, it's going to really continue to overwhelm our hospitals, our resources. And a lot of people with flu, which could have been prevented, are going to be getting COVID tests, which we know are in short supply. So we really want to make sure that the COVID tests are available for the patients who need them. And one good way to do that is to make sure that fewer people have flu.
All right, Julie Holland, thank you so much for your insight. Very helpful on this Friday. We appreciate it.
Thank you.
All right.